Just as with an unresponsive person, the primary assessment for someone who is responsive is to assess for and immediately treat life-threatening problems, including bleeding and shock. If it is safe for you to approach, do so. Introduce yourself. Let the person know you are first aid trained and there to help. Check for a diminished level of responsiveness. Assess for any difficulty in breathing. Scan the body for serious bleeding. If found, control it immediately. Check the face for tissue color. Assess the palms of the hands, fingernails, or inside the lip of a dark-skinned person. Tissue color depends on the amount of blood circulating below the skin. Normal tissue color is light pink. Paleness can indicate blood loss or shock. A bluish color can indicate a lack of oxygen. Assess skin temperature by touching the forehead with your bare wrist. Normal skin feels warm and dry. Cool, wet skin can be an indication of shock. Quickly activate EMS and provide any primary care when a life-threatening medical condition is found or suspected. When a primary assessment indicates no life-threatening problems, complete a secondary assessment to gather additional information. Quickly try to determine the person's chief complaint. Ask him what happened. If he cannot answer, ask bystanders. The person may have a medical alert bracelet or necklace identifying a medical condition that could be related to the current problem. The mechanism or forces that caused an injury may help predict the presence of a hidden injury. Clues in the environment, such as the temperature or the presence of medications or containers, may help identify the cause of the chief complaint. Physically assess the person. Briefly assess the body from head to toe. Look and feel for signs of illness and injury. The DOTS acronym helps to remind you what to look for: deformities, open injuries, tenderness, swelling. If needed, remove or cut away clothing to get a better look at an affected body part. If at any time you suspect spinal injury, immediately provide spinal motion restriction by manually stabilizing the head. Ask questions. Use the acronym SAMPLE, SAMPLE, to help you remember what to ask about. Things the person is feeling, such as pain, nausea, dizziness, or anything related to the situation. Things the person may be allergic to. Medications the person has been prescribed or is taking. Medical problems that may be related to what is going on. When the person last ate or drank. What the person was doing just prior to the problem. If you find or begin to suspect a life-threatening problem is occurring while performing a secondary assessment, stop, quickly activate EMS, and provide the primary care.